name is Dr. Doolittle, and I'm here to go over your genetic test results. Can you guys please confirm your names and your date of birth?
Yes, my name's Debbie Ryan, and you're watching Disney Channel. Got you, doctor. I was born April 1st, 2006. I'm also here with my baby daddy. He's right here. If you have any questions, he's super smart.
Sup, my name is Sam Milby Jerica Rosales III. I'm born on January 4th, 2005. My IQ is the same as my age, 15. That's pretty high. What? Hemophilia? Does that mean my kid likes blood?
Well, hemophilia means that your blood doesn't clot as well. So for someone with hemophilia, if they get a paper cut, they keep bleeding and bleeding, and it's harder for their bleeding to stop.
See, doctor, that makes so much sense now. We have to be super careful when my dad's working. He will injure himself or just be dangerous, and then he bleeds. We just have to make sure he's very careful. But your explanation makes a lot of sense, actually.
Exactly. And I know that it's already been established that you guys would like to keep this baby, so now I would like to discuss treatment options with you both. As of right now, there is no current cure for hemophilia. So what hemophilia patients do is they receive clotting factor replacement therapy, which means they replace the baby's blood clotting factors. And this therapy is the most common therapy used by hemophilia patients. But there's a newer treatment being researched, and it's called genetic engineering, and this involves editing your baby's genes.
Debbie, did you hear that? The doctor basically said we can turn our son into Wolverine.
Well, no, not really. So genetic engineering can cure hemophilia and allow your baby the chance to not suffer with hemophilia. So going through this procedure could prevent complications of hemophilia and possibly even extend your baby's life. When further research is done, genetic engineering can possibly even remove hemophilia from your bloodline by completely editing these genes.
So that means what you're saying is that our son can be a vampire and live forever. Hear that, Debbie? Hear that, Debbie? You know who it's like?
My gosh, yes, just like Edward Cullen.
So I know that this treatment sounds really cool and really exciting, but I do want you guys to know that there are risks. So the baby could end up being a stillbirth, premature birth, or end up in a miscarriage. And I know that many parents are not willing to take that risk, but this is all based off of your personal decisions and your personal beliefs. Also, since genes are going to be edited, there is also the possibility of new genes being introduced, which could result in another condition or disease that wasn't even there prior. So, genetic engineering is very expensive, and there's also always the risk that genetic engineering will not be totally successful in removing this condition from your child. Ultimately, this is your choice as a couple and as a family, and it does involve some ethical issues.
Dang it. But you know what? I do think I remember my mom telling me our church said that editing genes was bad. Something about, like, playing God. I mean, I don't know really, like, how we could play God. I mean, I'm an actress, but no one's that good.
Our parents are very super religious and they said it's super bad, you know.
Some people might feel that this procedure is extremely helpful in preventing unwanted diseases or conditions, but some people might feel that this procedure is unethical because it goes against what nature or God has intended for that person. I'd like for you both to take some time and to think about it and maybe discuss with your families what the best option for you would be. I want you guys to choose what you feel is truly best for your baby and what makes you feel the most comfortable and safe. So think about it, and then once you have decided what you want to do, come back to me and then we can create a plan based off of your decision, okay?
Thank you so much, Doc. You know, you're pretty cool for helping us out.
Ugh, that is so fetch. But I just want to thank you, doctor. We have learned so much today, and I guess we're just going to have to talk to my parents and see where they want to go from there. Because, I mean, in reality, who wouldn't want a perfect baby?